cooperation. First of all, let me give you some general advice about what medical support in our armed forces means. And something that is very important for us is the guiding principle that we try to fulfill, and that is to provide medical care to sick, injured, and wounded personnel, the outcome of which corresponds to the standards in Germany. This is a very ambitious goal and a very ambitious standard that we try to achieve, and it's the basis for all that we do with our personnel, with our material, with the education, and that's the guiding principle that we try to reach. And of course, over the whole casualty evacuation chain, we have to fulfill this ambitious goal, and military pharmacists are involved at all the different steps of this evacuation chain, because we have to provide the right material, the drugs, the medical equipment at all the different levels, in the right shape, in the right amount, at the right time. And that is very challenging, and we are trying to do that very well. And we try that to comply with the civil standards as well, because I think the civil standards are on a very high level from the educational side, from the scientific side, and we try to adapt the civil standards within our military environment. And therefore, this man who is half a physician and half a soldier and a medical officer as well. So we're not alone with our military pharmacists. We are 4 professions. We're the physicians, military medicine, military dentistry, military veterinary service, and the military pharmacy. And we try together to reach this ambitious goal. And now I'm going to start with the presentation as well. And you can see here what I'm going to talk about our capabilities, which comprise pharmacy, food chemistry, and medical material logistics. I'm going to focus on the personnel, on our human resources, which are very, very important, as you know. I'm going to tell you something about training and specialization. And at the end, I think maybe it's interesting to give you some information about what military pharmacists in Germany have done to fight against the corona crisis. I think maybe similar things that you are doing in your countries as well. And to come to an end, then international cooperation, as I already mentioned, with ICMM and FRP as well. So, military pharmacy capabilities. You can see these 3 pillars, which show the main fields of what military pharmacists in Germany do. We have on one side pharmacy, classical pharmacy. We have the food chemistry. This is a second university education that most of our military pharmacists get. And we are involved in medical logistics, of course, at home and on missions as well. But we are not doing only that, we are doing additional things. So military pharmacists are also working at the strategic level, for example, at the Federal Ministry of Defense. We have management function within the headquarters, as I am doing now as the senior pharmacy officer of the Bundeswehr. We are also involved in special science and training management, and you can see some of the facilities at our Institute of Pharmacology and Toxicology, but also at our Medical Service Academy, where education is done at a high level. And we are involved with our pharmacists in all these fields: armament and IT management, personnel management, quality management. So a lot of different fields where military pharmacists are working. So let us focus a little bit more of what pharmacy within military pharmacy in our country means. And you see some areas of work on this slide. I think some different areas of work that you might comment as well. The manufacturing of pharmaceutical products, for example, of course, that is something that all the pharmacists all over the world are doing, also at a large scale as well. And so these are the things that we are doing in the field of pharmacy. And for that, we have 4 big military hospitals, and all these hospitals have a hospital pharmacy. And I will focus on that, what we're doing there in the next slide. But you also can see here the Mali and Afghanistan, so in Africa and in Afghanistan, where we are also running military hospitals in mission, and they are also equipped with a pharmacy and with military pharmacists providing the material supply. Now, one of our Bundeswehr hospital pharmacies, as an example, what we are doing there, almost the same thing that in other military hospitals and civilian hospitals as well are done, with the manufacturing of pharmaceutical preparations and cytostatics, for example, then giving pharmaceutical advice in an interdisciplinary team together with the physicians to find the best medication for all the patients. So these are typical pharmaceutical tasks that you learn from your education, from the university, and what you are doing now and bringing it into practice in such an environment. We are also having a facility there with drug production on an industrial level, and you can see some of the examples. And as it is shown in the middle, the production portfolio is always adapted to the requirements. And at the moment, we are developing new auto-injectors for morphine and atropine, because it's difficult on the world market to get licensed product in these fields. And therefore, we are trying to develop this capability. And I hope that maybe 2023, 2024, we will be able to provide our first own military auto-injector. And we are not doing it only in Germany, we are also doing it in missions. I already mentioned that. And therefore, we have some pharmacy containers where we can provide these pharmaceutical tasks, or if we are longer within a mission, then we can do it also in solid infrastructure that is built in the country of mission. So food chemistry, this is a field you might not be very common with, because this is something special that military pharmacists in Germany do. So I won't spend too much time on that. Okay, there it is. So here you can see the different areas of work that we have in this field, with the surveillance of our dining facilities. And we are doing these things together with our veterinarians. So we are responsible for the chemical side, for this food safety and the water safety from the chemical side, regarding heavy metals, pesticides, mycotoxins, and other pollution, so that we can provide a safe and healthy food and drinking water. And the veterinarian are responsible for the microbiological side of the examination. And together we provide the food safety and food and water safety for our soldiers. So I think it's a little bit difficult now to get the same. I get some question for some comments, and now I'm not able, I think, to put on the next slide. So let us see. I will try it again. So I have to call it up again. Excuse me, because I'm not able to put in the next slide. I will try it again. Excuse me.
No worry, please take your time, Anna.
Yeah. So now it's getting again. Okay, we are doing these tasks and fulfilling these tasks in our central institutes that we have. Just only to give you an impression how this means, and we are doing that at home as well with the pharmaceutical tasks as under mission conditions as well. For example, the chemical analysis of drinking water in a military environment. This is very important because if we are on a mission, we can't bring all the water that we need there, and so we have to rely on the water resources that are on site. And it's one of the very important things to know very early, also for the military leader, whether we can use the water or for drinking purposes, or at least for washing. And so it's a very important task that we have to fulfill. And we have containerized field laboratories where we can carry out these tasks. And we also, as I mentioned, when we are longer in a special mission site, we also build then a solid infrastructure. And you can see on the right side our laboratory in Afghanistan, and it's almost like a laboratory that we can run here in Germany. So medical material logistics. This is a very important, and this is the key areas of work that we are doing, because providing the right material in the right amount at the right time, this is what is the most important task that we have in a military environment. And you can see some of the areas of work that we are fulfilling there, and I'm going to show you how we're doing that. We have 3 medical logistics centers. What is very important is that they are run as pharmacies, and they are led by military pharmacists, because the material that we have there are drugs, are medical devices, and they need the expertise of pharmacists, and therefore they are run as military pharmacies. And on the right side here, you can see our logistics center in Blankenburg, and you can see the big rock here. And we have a very big storage area within the rock, which is specially protected. And I think this is very important as well, because drugs and medical equipment are very valuable assets. And it's good to have also one storage site which is protected against any attack. And so we are very happy to have this opportunity as well. And what we are doing there, as I said, they are run as pharmacies. So we have also pharmaceutical tasks there, together with the drugs, and to make pharmaceutical preparations due to single prescriptions, for example. And but over and above more, we also have the storage and care of medical equipment, and not only the care, but also the checkup and the maintenance. So you can see here medical technicians which are working and which are very well educated, also from the companies, and they are able to fulfill first-line service and maintenance, what is very important, especially also in mission, where you don't have the service at very near. And so it's very good also to have soldiers, to have military personnel which are able to fulfill these tasks. And we're doing it, as I mentioned, sometimes intense. It depends on how long we are on a mission. And we're doing it when we are longer there in for example, in storehouses. And here you can see the storehouse in Mazar-e-Sharif in the north of Afghanistan. And there you can see it's similar to a big warehouse that could be in Germany as well. And we have, I think this is very important as well, some special tasks, not only the drugs that everybody knows and that everybody is dealing with, but also we are also involved in the provision of blood and blood products, very important in mission as well. And we are responsible for the oxygen production, which is also very important, especially when you are running a military hospital in a foreign country, to provide the oxygen supply as well. And as you can see here in Afghanistan, in the beginning, tent-based, and then afterwards on the right side, you can see the military hospital that we have there. I have been deployed there in 2009 by myself. And there we have the pharmacy as well. So, personnel. Just to give you an impression how many military pharmacists we have in Germany. You see 242 military pharmacists, more or less 65% male, 35% female, and most of them are career soldiers, so they stay with us their whole professional life. But we also have non-career soldiers which stay with us for 4 years, 6 years, 8 years, 10 years, but not for the whole profession life. And as I already mentioned, most of us have a double diploma. They have pharmacy and food chemistry as studies. And here you can see that most of us have these double diploma. So very important is as well, of course, and I think this is something which is interesting for you, especially for the young military cadets, how we are dealing with the education of our medical personnel. So we have on the first side we have the medical officer candidates which join the military after the school. Then they get medical officer candidates, and then they make their studies at civilian universities. So we don't have a military university for dentistry or for pharmacy. We are doing our studies in civil universities. We do the pharmacy and the food chemistry study. And then, in addition, we have, of course, a basic military training and officers training. The second way is a career changer. There are people that are already pharmacists and then join the military. It's sometimes only for some years to become a military pharmacist. And of course, there are a lot of things that military pharmacists have to learn to fulfill their tasks, because as I already showed you, they are doing a lot more than only pharmacy. And so they get these additional training that you can see here on the slide. And of course, lifelong learning, as everywhere, you always have to be state of the art and always have to get your skills at the right level. Especially in the field of pharmacy, we also have training institutions for specialized pharmacists in the different fields, and you can see the fields here on the slide. And the clinical pharmacy, of course, is one of the most important specializations we have to be on a high level, to be a good partner for our physicians regarding medication and the therapy for the patients, and therefore we must have these advanced skills. But also the other things, public health, also ecology and toxicology, especially for our food chemists, to see what, for example, heavy metals or pesticides are doing with the human body. So these are very important specialization fields as well. And over and above more, we are not. This is not for all our military pharmacists, but for some of them. For example, business economists. We are dealing when we are talking about drugs and medical devices. Also, it's a lot of money that is spent for that, and it's good also to have these economist skills as well to deal with it on a good way. And on the other side, for example, here you can see the technical sides. In our military pharmacists are also responsible for the procurement of medical equipment. And to do that well, it's also good to have some basic knowledge about these medical devices, on how a patient monitor, an X-ray machine, an injection pump, how it functions, to know the basics, also to make a good procurement afterwards. So, as I already mentioned at the end, I want to show you some examples what we as military pharmacists have done against for the fight against COVID-19. And at the very beginning, we were able to make the manufacturing and the filling up of disinfectants, especially in our military hospital pharmacies. And you can see here some slides which have been taken last year during this time. The second thing was the production of medical oxygen, because all of us know that we have a lot of patients on the intensive care station, and some of them, or a lot of them, have to be